really delighted to welcome Professor Brian Ferguson. Brian is the Director of the Public Health Research Programme for NIHR. And he has been part of that since 2020 and is hosted by the University of York as a professor in the Department of Health Sciences. Brian, some of you will know Brian well. He was the Chief Economist for Public Health England between 2013 and 2021. So that's quite a tenure. And Director of the Yorkshire and Humber Public Health Observatory, those of you that remember those. And is also a chair of the UK and Ireland Association for the Public Health Observatories from 2006 to 2011, so again, quite a tenure. And you've been Director of Centre for Health Economics at University of York. I think one of the relevant things for some of the people in the room is that Brian was a member of the panel for the Public Health Career Scientists that were, I think, probably finished around 2013, maybe a wee bit before that. But Brian, in his role as the Director of the Public Health Research Programme, has reinstigated that level of award as the Population Health Scientists. So please do check those out if you're not aware of them, because they're a great level of award and something new within the whole portfolio of research awards. So it's my absolute pleasure to invite Brian to speak. We've got about 15 minutes for this, but Brian's going to leave us some time for some questions and a bit of discussion before we close. So thank you, Brian.
Thank you. Thank you very much. Can you hear me okay at the back? Yeah, great. Well, that's a bit of an introduction to follow, actually. So I feel a bit of a fraud today because I came last night to a lovely dinner in York with the Arcs at Ashley and others' invitation, and now I'm here just before lunch. So all I do is come and eat your food. But it has been a crazy busy week, which I think partly reflects some of the success we've had in the programme recently. There's just so much on at the moment and such a focus on prevention and public health, which is great. So I'm very conscious that I'm, as Ashley's already said, between you and your lunch and wanting to get back to homes or work. So I'm not going to speak for long. The slides are going to be available. So again, don't feel the need to scribble. You'll see anything there that you want to follow up on. So I'm going to rattle through those and leave some time for questions. Now this first, there's a lot of detail in this slide, not to go through, but the two things that are highlighted there in the red circles, the things I was going to speak briefly about. This slide was part of a paper on strategy, public health research strategy that I took to the NIHR strategy board in March 21, which basically set the direction for a range of initiatives, and the two that are highlighted there I'm going to talk about. The only other thing I would say about this roadmap is it's a signal of tremendous success in the public health research field, that it's such a busy landscape now. If you drew this 25 years ago, there'd be hardly any of this there. And, you know, NICE, I mean, Catherine chaired the NICE Commission on Public Health Intervention. That's been going since 2005. Yeah, there we go. Memory's just about working. 2005. You know, all these things have all grown. The school, all these massive initiatives, and so, you know, many of you in the room have been and continue to be central to that success story of a really crowded landscape. So let me just say a little bit about the HDRCs there, and I've come this morning just hot foot from the first welcome webinar for all the HDRCs. So I hope many of you will know about them. I'm not going to read all that out, but really what the HDRCs are about my sort of one-liner on this is that the NHS R&D has had 30 years of research infrastructure, and it's taken that length of time to build that up. We haven't got that in local government, as you're well aware, and so we're about trying to build that research capacity in local government. Very much comes out of Chris Whitty's trip around many local authorities before the pandemic, and the two messages he came back with were there's no headspace or research money out there to do this, and also there's a big evidence gap around the wider determinants. And Helen Walters, who's consultant advisor to my programme, did a bit of work for Chris at the time that highlighted that. to cut to the chase, I mean, I'm really delighted that we had such a great response to the first wave, and we held interviews in June, July with 22 local areas. When we first went into this, we were looking to fund 5, and we'd got money for 5. But I've got to say the Department of Health and Social Care have been tremendously supportive about this. And before the interviews, the message I was getting was, if you feel we can fund more because they're above the quality bar, then tell us. So I'm delighted that we actually approved funding decisions for 10 HDRCs to start on the 1st of October this year, and 3 others that we are giving some development monies to. We felt they weren't quite there yet, but nearly there. So there's 13 in total. I didn't like ending up with 13, but that was where we ended up. We held our breath collectively over the summer when there was a real, at times, real concern about whether there was going to be the political backing for this. You know, we went from number 10 being directly interested in it to, you know, really towards the end of September, when Ashley and others and Eileen who are involved in the HDRCs don't know this, but we did get to a point where we were thinking, oh my God, they might pull this. But we got one of the ministers who was there for about 5 minutes, Robert Jenrick, who'd come from the local government department, very much got this, what we were trying to do, and backed it. So if you've seen the press release, you'll see the quote from him. The most important thing probably to say now is we are planning a second wave. We haven't got a timetable yet for that, but I'm trying to press DHSC colleagues over the next few weeks and months for us to get the second wave from spring next year, thereabouts. So, and the critical thing, and where I need your help, is in all your networks, you encourage people to talk to us about applying or talk to existing HDRCs. We've talked to a lot of the HDRCs, including this morning, about how they might mentor or provide support for other areas who might bid. But I'm absolutely delighted, and this was one of the reasons why we held our breath over the summer. I'm delighted that what we said we would do, which is to put money into the most deprived areas, we've done. And we will continue to do that, at least as long as I've got any say in it. But we have got an aspiration to get to as many as 30 of these, which would give geographical coverage. And we've talked to the Local Government Association and others about that. Everybody's on board with this. We just need to keep the momentum. So anything you can do to help would be greatly appreciated. So I won't read those out, they're in the slides, but these were just the quotes from Lucy Chappell and myself. And I said that I don't want you to be in any doubt about the huge commitment there is in the Department of Health and Social Care about this. As Ashley said, I spent 8 years of my life as chief economist in PHE and always making the case for investing in prevention, and everybody gets it. But the Treasury never quite goes as far as putting money into it, if we're honest. They're always looking for the quick wins. So when I took on the programme director role, DHSC and Chris and others were very clear that they wanted to put serious money into this, and they have done. We're a significant part of the NIHR now. So the last couple of things. Ashley's already mentioned it. Eileen will know because she's deputy chair of the panel that met on Tuesday, and we had a discussion on Tuesday about a range of things, including feedback that we've had today about the scheme, which is why it says their name under review. So we may change the name, but anyway, as Ashley said, this is very much about, again, this is a really the most important bullet point's probably the second one. This is about trying to develop the next generation of population health research leaders, and probably the only other couple of things to say is, again, it links very much again to the wider determinants, and we're also trying to reach disciplines that are the ones not usually associated with public health. So we absolutely want applications from statisticians, epidemiologists, health economists, whoever. We want all of that, but we're also trying to reach out to people who are doing work in environment or engineering, or things that are highly relevant to the wider population health issues like air quality and climate change. So again, as I said, anybody who wants to talk about whether they're eligible, get in touch with us. Trevor Sheldon chairs the assessment panel, as I say, Eileen's deputy chair, so there's plenty of opportunity to speak to people, including myself. And then lastly, and I'll skip over this slide, because is there a pointer on this? I think there is there? No, is it that one? Yeah. This was a question, sorry, about the acronyms. SRE is the Science, Research and Evidence bit of the Department of Health and Social Care, and their senior management team asked us this question about if we're going to achieve the level of ambition that we want for prevention and public health research, and that's a strap line from NIHR's 5-year strategy, so that is a big priority. What do we need? And to cut a long story short, we've got a working group that I chair that Ashley sits on, Department of Health, Helen, Jane West from the Clinical Research Network, and we're busy thinking about what the system needs. And my last slide is just, and again, this is a busy slide, I'm not going to go over, but this is a slide we're working on at the moment within NIHR. What we're trying to do is think about how we make NIHR more navigable, accessible to, particularly to local government colleagues, and even to ourselves. Let's be honest. These are just some of the bits. I think fairly comprehensive. But this bit here, the orange bit, is very much the public health activities. You'll see yourselves there, and a whole range of other things. And this is, if you like, the rest of NIHR. But we're making really important links with the academy around the career scientist work. Really important links that Ashley is very, very much involved in here, research support and this new National Research Support Service that is going to incorporate a lot of the activities we've done through the FRADA, for example. So there's a lot going on, but please don't read this as a structure diagram. This is not a structure, but what we're trying to do is say, even within public health in NIHR, there's a lot to be done to try and bring together more cohesively what's going on. But that is very much about trying to make everything more accessible to the outside world. So that's been a bit of a whistle-stop tour.